Good afternoon. My name is Eddie Richardson, and today I'm going to be discussing an emerging area of healthcare that has the potential to transform psychiatric care for adolescents, which is genomics. As a healthcare provider, we often focus on symptoms, diagnosis, medications, and discharge planning. However, we may overlook an important factor that influences treatment outcomes, which is genetics. By integrating genomic competencies into our nursing practice, we can provide more personalized care, improve medication management, and potentially reduce psychiatric readmissions among adolescents. Throughout this presentation, I will be discussing how genomic knowledge can enhance nurse-led discharge education and support better mental health outcomes. Psychiatric readmissions continues to be a significant concern in adolescent mental health care. Every readmission represents a disruption in treatment progress and often causes stress for both the patient and the family. These hospitalizations can interfere with education, relationships, and the overall quality of life. From a healthcare system's perspective, readmission contributes to rising cost and resource utilization. Many readmissions occur because patients struggle with medication adherence, system management, or access to appropriate follow-up care. This is where nurses can make a tremendous impact through effective discharge, education, and individualized care planning. Genomics is a study of a person's entire set of genes and how those genes interact with environmental factors. Unlike genetics, which often focuses on a single gene, genomics examines the broader picture. Researchers have discovered that many health conditions, including mental health illnesses, are influenced by a combination of genetics and environmental factors. Understanding these genetics allows healthcare providers to move toward personalized medicine where treatment plans are tailored to unique characteristics for each patient. Mental health disorders are among the most complex conditions in healthcare. Research has shown that disorders such as depression, anxiety, bipolar disorder, and schizophrenia often have hereditary components. While genetics alone does not determine whether someone develops a mental illness, it can increase susceptibility. Understanding family history and genetic predispositions allows healthcare providers to identify at-risk individuals and develop more proactive treatment strategies. The essential genetic and genomic competencies for nurses with graduate degrees provides a framework for incorporating genomics into practice. These competencies include gathering comprehensive family histories, identifying genetic risk factors, educating patients, and applying genomic information during clinical decision-making practices. Advanced practice nurses are expected to understand how genetics influence healthcare and knowledge that improves patient outcomes. One of the most promising applications of genomics in psychiatry is pharmacogenetics. Pharmacogenetics examines how genetic variations influences a person's response to medications. We have all seen patients who respond well to one medication while other patients experience side effects and from the same treatments. Genetic differences can help explain these variations. Pharmacogenetics testing can provide valuable information that helps providers choose medications more effectively and more safely. When medications are poorly tolerated and ineffective, patients are more likely to stop taking them. In psychiatric populations, medication non-adherence is one of the leading causes to relapse of rehospitalizations. By utilizing pharmacogenetics information, providers can potentially improve medication effectiveness and minimize adverse reactions and increase adherence to these medications. These improvements may contribute to lower psychiatric readmission rates. Discharge education is one of the most important responsibilities nurses perform. Effective education helps patients understand their diagnosis, their medications, the warning signs, and follow-up care plans. For adolescents, families' involvement is especially important. When discharge education is personalized and easy to understand, patients are more likely to adhere to these treatments and recommendations, recognize early signs of relapse. Integrating genomics into discharge education allows nurses to provide more personalized information. For example, explaining that individuals may respond differently to medications because of genetic factors can help patients understand why treatment plans sometimes change. Discussing family history can also help families recognize risk factors and participate more effectively into the ongoing care. Current research supports the integration of genomics into clinical practices. Studies have demonstrated that genomics guide treatment, guided treatments may improve medication outcomes and reduce trial and error prescribing, trial and error with prescribing medications. While more research is needed, existing evidence suggests that personalized approaches can enhance patient care and improve overall treatment effectiveness. As future psychiatric mental health nurse practitioners, we will play a crucial role and a central role in integrating genomics into practice. Mental health nurse practitioners are uniquely positioned to assess family history, educate patients, collaborate with interdisciplinary teams, and incorporate genomic information into treatment planning. Our ability to combine clinical expertise with patient-centered care makes us leaders in this evolving field. Genomic information presents unique ethical changes. Patients may have concerns about privacy, insurance, discrimination, or how genetic information will be used. Nurses must ensure information consent, protect confidentiality, and provide crucial and cultural sensitive education. Ethical practice is essential for implementing genomic informed care. Although genomic also offers many benefits, implementation remains challenging. Many providers have limited training in genomics. Cost and accessibility can also be barriers, particularly in underserved communities. Additionally, patients have varying levels of healthcare literacy, making education more difficult. Overall, these barriers will require continued education and organizational support. To future mental health care, to future The future of mental health care is moving toward precision medicine. Advances in genomic science will continue to improve our understanding of psychiatric disorders and treatment responses. As these tools become more accessible, healthcare providers will have greater opportunities to personalize treatment care plans and improve patient outcomes. In closing, this presentation, genomics has the potential to become a powerful tool in psychiatric nursing. By incorporating genomic competencies into advanced practices, nurses can help deliver more personalized care, improve medication management, and strengthen discharge education. Ultimately, these effects may reduce psychiatric readmissions and improve the life of adolescents and their families. The future of psychiatric care is not simply by treating the symptoms, it's also understanding the individual behind the symptoms. All right, and that's all.